It's one of those rare complications of surgery that do, in fact, happen. It's one of those that you think will never happen to you. What are you going to do when shit hits the fan?
Hey friends, this is the Next Level Glam podcast, and I'm Glam Gal. Thank you for joining me as I discuss all things transformation, inside and out, with my sisters in Christ. Pull up a chair, it's about to go next level.
Hey there, friend, and welcome back to another new episode of the Next Level Glam podcast with your host, me, Glam Gal. Thank you for joining me for the second part of the series of my round 2 in plastic surgery. Today, we're going to be focusing on the recovery of that surgery because it is such an important part of the overall surgical process. The surgery, if you've picked a great surgeon, is the easy part, right? You lay on the table and you wake up and they did their magic. But now the hard part really comes, and it's really what I feel is the guts of the whole entire process. It's the recovery part. And sometimes, no matter how much research you do, it can't necessarily prepare you for what you're going to face. But if there's anything that I can do to prepare you if you're on the journey of going after plastic surgery, I am willing to share with you some of the things that I've gone through to help you out. You know, anything that I can do to make it an easier process for you, or if you're going through the recovery, if it's just to kind of share in some of the trials that we experience, because it's not really always talked about when we're talking about plastic surgery. You know, if that helps you to know that you're not alone, that's what I'm here for. As I've said many times before, people look at your before and after and they think that you just go for surgery and then within a week or two, you're back to regular life. And I'm here to kind of dispel that a little bit. I will say that I've seen some what I want to call freaks of nature who undergo multiple procedures at the same time, and they seem to just kind of pop on up after day 3, day 4, and they are back to doing regular things, or they're traveling and things like that. And that really does blow my mind. I really want to say that that's like 10% of what really occurs in recovery. But at the same time, it really depends on, again, how much surgery you're getting and who's doing your surgery. I have shared that I went to Dr. Ramson Azizi in Chicago, Illinois, and he is a very aggressive surgeon. He really goes hard in the paint when it comes to getting you your results and getting you to a result that you're happy with. So, where we left off, I was going to my consult at 6 months out of surgery from my 2020 round, and I waited about a year and a half to do my second round of surgery. Like I've said in the episode that has to do with my round 1, that the recovery had its challenges. You know, it was painful and it was lengthy, and there were things like swelling and other things like delayed healing that popped up a little bit. But overall, my experience was smooth sailing compared to a lot of other people. It wasn't easy, but it gave me enough confidence to go to my doctor at that meeting and jokingly but seriously ask him to have me look like a mummy the next time I leave the table. Meaning, I wanted to get as much done as possible. I was very enthusiastic because I saw how drastic your results can be in just a round of surgery. So we agreed again to do a tummy tuck with muscle repair, some lipo with that. I did some lipo of my thighs, lipo of my double chin, and then I had a fat transfer, aka a BBL, to my butt and hips. And I also put fat in my already lifted breasts. This would be my second round of fat transfer to the breasts. And then I also put some in my lips and in my under eyes. So that's what was facing me early January of 2022. I hopped back on that table, and I'm not going to lie. I mean, I did my research. I knew what I was looking at. I know a lot of people kind of get squirrely when they look at the procedures that some people do to get these results. I remember when I was younger and I found out what liposuction was, it blew my mind that somebody would actually want an inserted cannula between their skin in a very rigorous movement, and it just looked so incredibly painful, right? And I guess I've been desensitized to that a little bit, but the tummy tuck thing I knew for sure had me the most concerned because there's a lot of major things going on with a tummy tuck. And if you know anything about a tummy tuck, they're cutting your skin off and they basically use a giant meat hook to stretch your skin down. And it almost looks very barbaric when you're looking behind the scenes of like what your body is going to go through in this round. And I knew that, and I prepared for it as best as possible. I know I took off the standard 8 to 10 weeks from my job. I was really preparing my body for surgery as best as I knew how. And I remember the night before surgery that my stomach felt like I was on the edge of a high diving board. and like mentally saw myself taking the leap off the high diving board into the tummy tuck round two scenario that was facing me, because as much as I'm enthusiastic about it, I do realize that the risks that you're taking, which is why, again, guys, I can't emphasize enough that you have a really great surgeon, a really great rapport with that surgeon, and that you really think about the post-op care that they're providing you. When you go into that pre-op appointment where they're going over the final things, they're going to have you sign some paperwork. They're going to have you read through a little booklet of things to bring to your knowledge, like the risks that you're signing off for. Like I said, I did my research. I knew that things like seromas were a possibility, some bad scars, infections, yes, death, obviously, which is a small risk if you've passed your labs and you have a safe doctor. It's really not the biggest concern to be worried about. But there are other things that I really didn't think that would ever happen to me. I remember reading that stack of papers and thinking to myself, "Ooh, that would be bad." You know what I mean? But it didn't really click that again, it could happen to me. I just kind of glazed over it and signed my name and was just kind of excited to move forward. As I've stated in the other episode, my doctor now has his own private surgery clinic. But the same hospital that I had my first round of surgery in is the same hospital that I had round two. And both times at that hospital going into surgery, I had really great attendance. They were wonderful. I hated the fact that regulations, even in 2022, were going on in this area. So things like masks and the fact that my husband was not allowed to join me before surgery or after surgery. I woke up in a recovery room with other people. He was nowhere in sight, and the staff had changed. So I didn't see any familiar faces outside of my doctor coming to acknowledge what we did in surgery and tell me that, he talked to my husband and all of that, but they make you do some recovery. And waking up from surgery is really, really intense. It's different for everybody because the anesthesia is so different for everybody. And I will say that nausea is definitely something that comes with the territory for me. I cannot get that Zofran soon enough. And honestly, the pain can be immense. And at this time, it really wasn't from my tummy tuck, it was from the liposuction. I do find that liposuction can really take it out of you. You know what I mean? Especially again, if you have an aggressive surgeon, you know what I mean? So the doctor left me in the care of my post-op nurses. I was very confused. Immediately, I was asking for my husband to come in and pick me up. And true to form, I woke up looking like a mummy, no doubt about it. My enthusiasm overall was super high. I'm always so grateful to have plastic surgery. I'm grateful to, wake up alive, get the recovery process going. But there were some things that my doctor and I talked about before surgery about his preferences as far as positioning. As I shared, I had a BBL, and more times than not, doctors want you off of that BBL for like 3 weeks, but yet you're not really supposed to lay on your stomach from the tummy tuck. So he had a certain position that he'd like me to be in. He has shared on his Instagram too about the realities of recovering from plastic surgery combination procedures, on how people are going to recover realistically. Like you think you're going to be okay not moving for 3 weeks or not doing something for a certain amount of time, but it's actually super challenging, and they want the best recovery for you because it affects your results. So when my husband picked me up, he put me in the back seat and I was positioned the way the doctor wanted me to. And I did have some reservations about that, to be honest, but I was in really great spirits and we had a 3.5 hour car ride back. I did not want to stay in the area. I just wanted to get home and recover at home. And I would be back for like my week appointment. So it was literally a blizzard driving home. I can't give my husband enough props for being as generous and patient and as caring as he is to have been there for me, not just the first time, but the second time, and be genuinely happy for me and comforting to me. And it was a really long drive back. And I think what I wasn't necessarily prepared for was how tight my tummy tuck would be, because some people apparently are able to stand up straight same day or a couple of days out. But the tummy tuck I had was so tight that I was almost walking at a 90-degree angle where I was like hunched completely over. I couldn't stand up. I couldn't do anything like that. I had the burning sensation from the liposuction. And at this point, Any of the other fat transfer places I got, like the lips, the under eyes, the chin, none of that even fazed me whatsoever. It was mostly the body liposuction, the fat transfer to the hip and butt, and the back pain that was coming from being hunched over from that muscle repair. And that tummy tuck was the instantaneous thing that I noticed the most. Now, I will say that my surgeon included something called Exparel, which is some kind of pain medication that they inject straightly into your muscles, and it really helps with that pain for the first few days. So you're rather numb, but you do have to be careful because it is numb, and sometimes you can go and do more than you're supposed to or more than your body really is capable of because you're not really in check with like what the situation is, you know? So I finally got home, and the challenging part on a personal level was that my husband had just had wrist surgery. It was something that was unforeseen, and it kind of crossed over into my surgery time. So he was very limited as to being able to help me as well as he helped me in that first round. And we had to really come together for teamwork because, my husband wasn't raised to be a caregiver. He had never been a real caregiver before. And even though I expected his help with my first round, I was a lot more independent sooner with that surgery than this tummy tuck. I really felt very limited as to what I can do. Short walks were intimidating. When you get home, you want to get yourself positioned. And I had created this thing called like the BBL chair. Everybody was saying it was a great idea where like you get a gravity chair and you cut a hole in the butt. That way you can sit without, you know what I mean, without putting pressure on your butt. And honestly, if you're thinking about doing that, don't. It's such a huge waste of money. And it was so incredibly hard getting in and out of that chair. Definitely get yourself an electric recliner. That's definitely worth the hassle. You can rent or buy one. You can even find them for cheap at the thrift store. But that's one thing right off the bat I wish I would have done differently. But you're supposed to get up every hour or two to walk around to prevent blood clots after surgery, right? And it sounds easy enough, but number one, you're just absolutely zonked out on drugs, right? You're not even all the way there. And you realize that every time that you sit down, it's a relief, but you need to be repositioned often, which is really, really hard to do. You don't have your ab muscles. This is why me working out and making sure my upper arm strength was in a better place was so important because I really needed to use my arms to make up for the fact that my legs were weak. I couldn't walk. I couldn't just pull myself off the toilet. The things that you take for granted, all of a sudden you're not even able to use those. You realize that even though it hurts to move, if you sit too long, it actually makes you more stiff. So it really is important that you're getting up and moving and trying to stretch out and try to stand up straight, but you definitely don't want to push it either. I see a lot of people out there using walkers and stuff to help them walk, and I understand what they're trying to do, but ultimately, like what my doctor said, because I was thinking about doing that, he said what that will do is promote more swelling in the belly. And really, we just have to learn how to slowly stretch up over time. I will say, in that regard, I was not able to stand up straight for 6 to 8 weeks. And even then, it wasn't like fully extended straight. It was a very long go of back pain. And I think that's what most people complain of, honestly, after a tummy tuck and combo procedure, especially, is the limited positioning. You get sick of sitting in the same position, and all you get is a varying degree of change amongst those positions. I realized actually within the first couple of days that the position that he mainly wanted me to recover in was not feasible for a couple of reasons. First of all, I literally couldn't do it. And second of all, about 24 hours after surgery, I decided to check my tummy tuck. And this is why this episode is called When Hits the Fan. I have seen enough in my research about what a normal tummy tuck recovery looks like. I knew what I was looking for, okay? And I expected certain things. But as I was slowly unhooking my compression suit that they put you in after surgery, I knew instantaneously that something was wrong. I think if I wasn't so zonked out on the painkillers, I probably would have had more of a reaction. But I remember having a moment of panic, but kind of just being like, well, here we go. I didn't want to jump to any conclusions. It doesn't pay to panic in that regard. But this is when it was super helpful to be able to reach out to my plastic surgeon via Instagram. And my husband and I sent some pictures of what we were seeing and experiencing. And we knew that we had our weekly checkup coming up because my first checkup would be at the week mark. So, what my doctor responded with is that to keep our eye on it, to not lay on it at all, like not to do that positioning he said to it all, to undo compression and to kind of take it easy and keep our eyes on it and monitor it. So, for that first week, I was kind of really detached from what was going on with me. I was really trying to stay positive. And honestly, I was trying to stay off anything that was surgery page related because, as much as those are very helpful resources for your recovery, for your research, all of that, it can actually do harm in recovery when you run into issues. And there are about 1,000 different people who have 500 different doctors and they all do things differently. This is when it really hones in on, are you going to trust your provider or not? Okay. So, because I didn't have a fever and I didn't feel any other symptoms, I held out for that first week appointment. And I'm not going to lie to you that that was probably the first appointment that I had gone to where I didn't know if I was going to make it. Like it was super intense. I was so tired. I wasn't really sleeping well. It's really hard to sleep. You sleep when you pass out from exhaustion from not being able to sleep, essentially. You know what I mean? And it was such a feat to just get to the car. And it was such a feat to drive the 3.5 hours and get up to the hospital floor, and you can't really sit on those chairs. When people don't understand, like when you're having a singular surgery, you're focused on that one area, but when you have a combination surgery, it can be very overwhelming with all the areas that you have to pay attention to. And immediately, because of the situation that was going on with my tummy tuck, which at that time looked like very deep, severe bruising that was spreading from up and down my incision to my belly button. And I didn't even want to say the word that I was thinking it was. It really forced me to already put my BBL results, my BBL recovery on the back burner versus the tummy tuck. And all you can do is hope and pray that it all shakes out in the wash. But this is why sometimes combination surgeries can be a challenge because it takes away from your results. Like if you did separate surgeries and you can really baby that area specifically, that is the best route, in my opinion. You know what I mean? But time and money is time and money. So that's why I decided to go this route. But I was really nervous for that first appointment at a week out. And, so was my husband. I just had so much guilt already building up that this was going to be a process. And I really couldn't even check in at that point about what I was looking at. So my doctor came in and I really didn't want to hear the word necrosis. Okay. Like I did not want to hear that. And I didn't hear that. He didn't say the word necrosis because I think he knew what people see as necrosis. Now, what is necrosis? All right. A lot of people think necrosis is an infection. It's not, okay? Necrosis is basically when your skin isn't getting the blood supply it needs to, so it starts to die off. And the wound opens and starts separating because it's not getting that blood supply like it should. It took a beating, so to speak. So all of that bruising was getting pretty extreme. And I have seen some really intense outcomes with people with necrosis. And I don't even know if I really was mentally ready to go there. But when he checked my wound, praise the Lord, guys, it had really minimized to about, a few inches long and like maybe an inch or two in width. So at that appointment, he was relieved to see that it had minimized and again reassured me that he was going to be there to make sure that we took care of it, that we were going to keep our eyes on it, and that he actually thought it was a decent size compared to what his worst fear was, as far as it being bigger than what we were going to expect. Now, at that time, my body hadn't opened up or anything like that. This was just the bruising part that happened. And he prepared me by saying that the top of the skin was going to form like a scab essentially. And he was going to treat it like basically a bio band-aid, that we were going to let that scab off and let it protect the underneath for as long as possible. And, when you're in these appointments, sometimes this is why it's so important to have someone with you because it's like the information, you're just in survival mode. I mean, I guess that's the biggest comparison that I can say is like I was in survival mode. I was just like, okay, I'm alive. I'm grateful that he's willing to see me. I was nervous because there are doctors out there when shit hits the fan that all of a sudden they go MIA. They're not responsive to your texts. They don't want anything to do with you. Some people even experience doctors reaching out to tell them to have like a NDA, like you're not allowed to talk about your experience online. And I was just panicked because, of course, I wanted to reach out to other people who might have been going through this or get some kind of support from dolls. And it's one of those rare complications of surgery that do, in fact, happen. It's one of those that you think will never happen to you. I surely almost looked at it as like a punishment. Like, why would God do this to me? I felt terrible because I know my surgeon worked so hard and I felt like it was my fault that I did something. Like, maybe I didn't have enough protein before surgery. Maybe I was riding in the wrong position for 3.5 hours on the way home. Maybe this, maybe that. And like he said, it's like Russian roulette. There is no reason for it. It just happens sometimes. But the difference is how are they going to handle it? How are they going to get you across that finish line? That's what's really important. So it's like in the surgery community, they always pointed out that necrosis happens to people who do this or do that. My personal thing on it is that my body went through some very extreme adjustment. My body went through hell and back on that surgery table and it kind of went into shock. Okay. That's how I look at it. Ultimately, God was going to use this to show me his faithfulness and provision with my doctor. Because, I mean, I really thought I had it in the bag. I really thought that by having a top tier doctor, that it would absolve most of my issues. But the fact of the matter is, even these kinds of complications, though not as common as seromas or fibrosis, they do in fact happen to the best surgeons and to the best patients. What I needed to do was apparently at this time was to go home and be on bed rest as much as possible. I really needed to let the tissues in my tummy tuck heal. Exerting myself and stressing myself out was not an option. My husband took about a week off in preparation for this, and honestly, immediately I knew that wasn't going to be enough. And I was so grateful that he was able to work from home when he needed to, and he did eventually have to go back to work. And so my husband ended up taking about that week or two off, and that was helpful. He took really great care of me. This time I was already looking at more visits to my plastic surgeon's office. My last round, I went there for the standard checkups. I didn't have a need to go in any more or any less. And now I was realizing like how much that 3.5 hours really, I mean, I couldn't have imagined going any further from home, is my point. You know what I'm saying? I was going to be making regular trips down to Chicago for checkups and things like that. So at about 2 weeks, I remember waking up, my husband was going to go back to work, and I was finally feeling able to like roll out of bed and go down the stairs and make him some coffee. I just felt like I wanted to give back for him taking care of me. And I was feeling good about him going back to work. And I'm like, yes, okay, I got this. And no sooner did he leave for work than all of a sudden I experienced fluid coming out of my wound. And it wasn't just any kind of fluid, it was foul, it was scary. And immediately my brain went to infection, right? Even though I like clean sheets, I'm taking care of it the way my doctor said, I'm going through first aid kit products, things like that to make sure I'm all taken care of. And this sent me over the edge, you know what I mean? I reached out to my doctor to make him aware and to also be reminded that this was normal because it wasn't just a few drops of fluid. It was disgusting, to be honest with you. All that fluid from your body is coming out like garbage goo. And it's hard, number one, not to be frightened. It's hard not to be grossed out. It's hard to be calm in that situation. All of a sudden, my husband was nowhere around to comfort me, and I called him in a panic. And obviously, I talked to my doctor, who reminded me that we were expecting this. He just seemed very separate from it because I was living it, right? And all of a sudden, my life became about me completely being in bed. If I moved or I rolled over, all this fluid would just come out, and it was disgusting. I had to use like maxi pads and it didn't make me want to go and live life. That was probably the darkest times of my life. After that happened to me with the fluids coming out and I was afraid I was getting an infection, um, I was damn near hysterical, guys. I really, really was. I could reach out to my doctor. I knew he was there, but I knew that I had to get a grip on what I was experiencing. I had to remind myself of the research, and I had to realize that I didn't do that much research on necrosis. And just a short dip of research made me even more panicky, hearing things like wound vac or even death or 6 months of having an open wound. And I only took 8 to 10 weeks off. I really was worried about like the financial setback of everything. It just really sucked the fun out of life. I really felt like I took the X amount of thousands of dollars and just pissed them away. It was such a deep despair that over the next couple of weeks, as that was going on, I was having daily emotional breakdowns as my husband would go to work. He felt really bad leaving me in that state, but there were days where I was just inconsolable. And honestly, I spent a lot of time by myself. I didn't let a lot of people in my life know that I was having surgery, and a lot of people just live their life. They kind of forget that you're out there going through something incredibly traumatic. Not that I was completely open with everybody about what was going on because people have their opinions. People can be incredibly hurtful. And I think that what this experience did teach me overall was empathy. And it's not all sunshine and rainbows and cupcakes, okay? Some people are very fortunate, and I'm not trying to scare you. I'm trying to keep it freaking real, man. This stuff does happen. And I don't, like I said, there's really no way to prepare for it until you go through it, unless you have done all of your research. But even then, the real life that you're living behind all your knowledge, it's just something out of this world. And at about 6 weeks, I went in. It was about Valentine's Day of 2022, and the covering on my wound, which was the dead skin, right, was barely hanging on. And my doctor said he wanted to remove it, and I was just petrified, guys. I mean, I was in the surgery group so hard doing something that I'm telling you that if you're going to go through surgery, it's fine to have some surgical references at hand, but really, you need to be focused on your own recovery and not giving in to fear porn about your recovery, because you're going to see a vast amount of things that will panic you about your doctor, about your situation, about what can happen. And eventually, guys, I had to get to the point where I had to shut it down. I had to remove myself from the groups. I had to like get in the word. What does God say? That he uses all things for our good. It was just really hard to see at that time what that good was going to be. And I was actually terrified of the pain. I walked in and I saw these utensils out on the counter that he was planning to use at this appointment. And I remember him walking in and looking at me in the eye and telling me, he's like, "Are you scared?" And I was like, "Yes. Looks like the Civil War over here. Like this is very traumatic and very much like it was too much for my brain to realize what was going on." He assured me that it was not going to be painful at all, that it's just like dead skin, so you're not going to feel it. And he has this really wonderful bedside manner of somehow making this unbearable situation bearable, not just for me, but for my husband. I don't know if you heard me. He wasn't raised to be a caregiver or someone who's working with bio issues. Okay, like covering a scrape with a band-aid, sure, my husband can handle it. But we're talking about stuff that most people do not want to see. We're talking about a situation that if I posted it on Instagram or Facebook would cover up my scenario because it's too triggering for people. And that is just the honest truth. I haven't decided if I'm ever going to release those photos onto Instagram, to share what it's really like in photos of what I went through. The point is, he removed that skin. I didn't feel anything. I just remember squeezing my husband's hand so incredibly tight, not being able to look down, not being able to take in what was going on, because once he had removed that scab over the incision, I was left with like an opening that was like this big. It was right amid the scar line of my tummy tuck. And I knew what was there was exposed whatever, you know what I mean? What lies beneath of your skin, you know what I mean? There was a deep cavity opening in my body, guys. And my doctor was really great about having my husband come over and get him trained to pack my wounds and then we would place the bandages over that. We would do that twice a day. My doctor said that if I continued taking it easy, that we would assess and go from there. And I mean, he only gave me the information that I needed to get to the next step. And I actually really appreciated that from Dr. Azizi. At first, I was kind of confused. I'm like, why is he so chill about it? And I have to realize that he was not necessarily chill about the situation, but he needed to do that for me because he needed to make it clear to me, number one, that he's got this. Okay. He had a plan A. Plan A did not go well. We're going to do plan B. We're going to take it as it comes. It was something, honestly, when they say you wouldn't wish it on your worst enemy. I wouldn't wish it on my worst enemy. It was really intense what it does to your self-esteem, what it did to my marriage at that time, which was put extra stressors on it. I really was ultimately utterly dependent on my husband and his care, his emotional support. Even the most generous, kind, loving partner that you have does have limits, where it's like all about me. I'm utterly consumed in my mess. Every day you come home from work and there's your wife who is just rotting in bed, and then you have to change their bandages of these wounds every single day, twice a day. It got to the point where like I would have to look at myself and take a tweezers and pull the bandages out, and then my husband would quickly pack them in and then we would cover it. It was what we dreaded the most, but we were able to do it together. And there aren't words to describe the love and the respect and the loyalty that I have for my husband and that he has for me, because nobody wants to do that kind of thing and nobody wants their husband to see them like that. And it was a really heartbreaking time for me. I really felt super alone. It's not something that you always want to talk about with people. Nobody really understands. When things initially happened, I was talking to my doctor in the DMs and I was freaking out. Like, is this going to be like a 6 month thing? Am I going to need a wound vac? And he was like, Jillian, I could take you into the OR right now and sew you up, but those tissues are so fragile that it would just fizzle. And he's like, so what I really need you to do is take it easy, baby that area, and we will assess further on out what we need to do. And he's like, if your tissues get better, we can take you in. And it's hard because I had people who had gone through plastic surgery, even friends of mine, questioning my loyalty to my doctor's plan of care for me. I had friends putting fear into my head, saying that I was going to have an open cavity in my torso with giant scarring for 6 months. This is why it's so important that you do your research, that you stand behind your decision, and that you limit what people say and possibly what you share with people, because keeping a positive mindset when all of this is going on is important. And I tried to distract myself by watching shows and movies and reading the word and social media, things like that to spend your days. But there are just points in the days where you're just, I don't even know how I got through it except the grace of God. And I was about to witness further the grace of God when at my next appointment, my doctor scheduled me. I think it was March 9th was finally the time that we scheduled him to take me into the OR to close me on up. And I felt so grateful because, like I just said, there are people on wound vacs for half a year. There are people who wait to have that opening naturally close. Everybody else was telling me that that's what was going to go on. This is why ultimately I paid through the roof for my provider, because he gave me amazing post-op care. He scheduled the surgery. I didn't pay a damn dime. I went there in the morning for a quick surgery. They were going to close me up. He took a look at the tissues before surgery and he was really, really happy with how they were looking. He felt confident that by taking me in, it would stay closed. When I woke up from surgery and I looked down and I saw that gaping wound closed, and not just closed, guys, that part of my tummy tuck scar to this day is the cleanest, best part of my actual tummy tuck. I felt put back together again. I felt like I could go home and finish the rest of the recovery with a smile on my face. I had my surgery January 5th, and I had my second surgery revision to close it on March 9th. That is how much time I was bedridden for. Now, towards the end of that time, I could walk around, I could go to the stores or do very small errands and things like that, or little things around the house. But again, like if you don't understand that you have this open wound with all these fluids and stuff, I just mentally couldn't go out in the world for too long without being worried about like the stench or like what if it like bled through my clothing. It was too much of a stress factor. So I lived a very small, sheltered winter life that year with like hardly anybody knowing what was going on behind the scenes. And I just basically looked forward going to my doctor appointments. That was my social life at that time. After Dr. Azizi did that for me, that's when I was saying in my first round that like I saw God move through him because he provided me a great recovery despite the circumstances. Necrosis is never a wonderful thing to hear. Nobody wants to hear that in their recovery. But it was like the best outcome for the worst situation possible. And I had so much understanding from my doctor. He was so wonderful and open about wanting to get his patients across the finish line. Like I felt confident after my first round of surgery with Dr. Azizi that he did a wonderful job. He was a great doctor. But after this round, he is literally the best doctor, period. I don't care what anybody has to say. The way that he treated me as a patient, the way he took care of me, the way that he provided to fix the issue without any cost to me. I mean, they have to pay something, anesthesia costs something, you going to the hospital costs something, everything costs something. So I was already thinking about this initially on day one when I opened up my garment and I saw what was going on. All I thought about was, I'm losing money. I won't be back to work for months. And it's true. I took about 4 to 5 months off of work before I could even go back. All of the extra driving to Chicago, possibly having to pay thousands of dollars I wasn't budgeted for to get back into surgery. This was one of the biggest gifts from God that I've ever gotten. And people can judge if they want, but that's just facts. So once that surgery was done, and I had about a week to let that revision heal, I felt better than I had felt in a long time because when people don't realize that your emotional and mental state are directly connected to your physical state. You know what I'm saying? Trying to keep a positive vibe is super hard, but it is incredibly helpful. But I will say that aside from that part of the recovery, it was super hard because like my overall self-care just went down the hill. Like I was asking so much of my husband on a daily basis. The day before this revision, I remember it getting to a frizzied, tizzied peak of tension in my marriage because it had been almost 8 to 10 weeks of him constantly giving to me, right? Constantly all about me, running my errands, making sure I had my meals, dealing with my emotions, getting me down to Chicago. There was just this weird tension that was building, almost kind of like a resentment that was building towards that bridge point, wondering if I was going to be able to get that closed or what my life was going to look like. And it's my fault in reality because I was not capable of returning any kind of normalcy to my husband. I wasn't even myself during those weeks, so it's no surprise that I got there and we definitely had this like implosion the day before surgery. There are times in your relationship, your marriage, where you wonder if it's going to survive it. This was one of those times for me to wonder if my husband could really love me through like what this had made me become and how it had made me act. I had lost myself there for a minute or two. We hashed it out on the way down and, we cried together and worked it out together. I knew that he had real feelings and he was allowed to feel those feelings. And that was kind of hard for me to process. It's crazy how far apart 1 minute that you can feel from your person and then you can snap your fingers and get to a place of forgiveness and have all of this love for them that comes out of nowhere. And that's how it really was for me as I went into that surgery and I woke up and he was just again there for me 110% and took care of me. And it was like we both felt this huge relief off our shoulders after that surgery, after I was closed up and knew that the worst was behind us. I still had months and months of recovery left. Heal time for the fat transferred areas that I have. I was behind on my compression because I couldn't have tight compression. I had to sit on my butt a lot in bed. It was like, who knows how it's going to go, but I will say I did start to experience at about month three, month four, some variables coming up on my hip, thigh area. And that was like a double hit for me because I felt like it was my fault from sitting on my butt during the recovery. And this is what I'm talking about with the combination procedures. When did that happen? You don't want to, but you almost feel like you need to inspect yourself in the mirror every day to keep your eye on all of these areas that you had surgery on. But as far as like the fat transfer to the face, the chin lipo in general, I knew how to deal with that. It was really the tummy tuck scenario that took the cake on this round. There's a lot of swelling that exists in tummy tucks. It's a huge maintenance lifestyle of self-care to the point where I almost didn't have time for my everyday regular self-care beyond brushing my teeth and maybe splashing my face with water. Like it's hard when you ask them to do all these things for you and you're like, I really need my foot scrubbed, right? Like you don't want to ask him to do another thing. So by the time that I was capable of really doing my self-care, I was a freaking mess. Like I needed a pedicure, I needed a wax, I needed a hair wash and style. I needed like all of these things. And it truly put me back into like a gremlin part for damn near 4 to 5 months of my life. And I can't believe that I'm already 3 years out from that process. And there was a time I thought I'd never get past it, that it would just always haunt me. And me and my husband still talk about it to this day, about what we went through and what we dealt with together and how we overcame it. And ultimately, yeah, we experienced a lot of ups and downs in that short amount of time. The highs were highs and the lows were lows. Mostly lows, guys, mostly lows. But ultimately, I see it as strengthening our relationship and our loyalty and our love for one another. There isn't anything I could ever do to repay him for taking care of me during that time. But like I said, this whole entire plastic surgery journey stemmed not just from me wanting to do it for myself, but it was an investment overall into my marriage. And you either know or you don't. So, what I really want you to take away from this episode, as far as my recovery with round two, is to reiterate what I've been saying from day one, which is do your research. Pick a surgeon that's in your location that you could be a drive away from, like know your limits. But I will tell you that 3.5 hours, that was definitely enough. When it came to how many times I visited Dr. Zizi's office for the first 6 months after surgery, quite a bit. Quite a few trips to Chicago. Your surgeon is like the most important thing that you choose, period. Not just their ability, but also their post-op care. When you're sitting there and you're signing those documents about risks, yes, you can get necrosis. Yes, you can get ugly scars. Yes, you can have fibrosis. Yes, you can have some other weird complication that's not talked about enough in the surgery groups. Trust me. Will a mindset of positivity and chill help tremendously? Yes, you should definitely go into surgery being positive, but prepared. This is why I always tell people to take off more time than they actually budget for, because you don't know what's going to happen. I had to really roll with the seat of my pants day by day, wondering, what is this wound going to look like today? When am I going to get surgery to close this up? How long is this going to take? So many days laying in bed by myself, just feeling so lost and disappointed and confused and selfish and basically just a burden. You know what I'm saying? But here I am 3 years later, and my results are amazing. I have way more appreciation than I ever thought possible for my doctor, for his staff, for scientific advancement to do what he did to shorten my pain, essentially. He has sisters, a wife, and a mother, and he just thinks to himself, how would I want them treated? You know what I mean? What would I want for them? And you could feel that. And honestly, it's like I paid for that, but it still feels like, wow, what a freaking miracle. After that round two, I was sold on Dr. Azizi and continue to want to work with him in the future, because I know no matter what pops up in post-op life, he's going to have me and he's going to get me across that finish line. And I have such an appreciation for my husband, for my marriage, for the ability that it has to rebound and grow during the good times and the bad. My husband would even testify about that whole entire experience, about how, looking back, how blessed we were and how it all just kind of shook out. But ultimately, guys, I am super filled with God's grace about that whole entire scenario. And now I go into surgery not really freaked out if God's going to punish me with it or if some kind of complication is going to ruin me. I have trust in the Lord that He's going to provide, as He's provided me with the best husband, with the best doctor, to make my goals a dream come true. And I'm not saying it's easy. That was probably one of the most difficult recoveries I could ever imagine on somebody. It's scary, but with some research preparation and some honest communication with your surgeon that is top tier, I don't want to hear you looking at Groupon for tummy tuck doctors or plastic surgeons. Please do not do that. Because, like, what are you going to do when times get tough? What are you going to do when you came back out of the States and you get necrosis or an infection? What are you going to do when shit hits the fan? This was something I was really grateful that my best friend told me before I decided to go with my doctor because I was ready to go to Mexico and realizing that I could have gotten a complication of this magnitude flown back to the States and nobody would have worked with me. I would have had to go to some kind of like wound care place and had a wound vac. No doctor would have wanted to work with me. So it's like when shit hit the fan, having that post-op care was everything. Having that top-tier doctor was everything. And there were times along that journey I was questioning my doctor's route. It wasn't easy to fully trust my doctor. It was a day by day decision, trusting in that God had provided me this surgeon, and I trusted in my research about his certifications, right? I had to trust the plan and not what people were saying in groups, not what my best friend was saying, not even what my worst case scenario in my brain was saying. I had to trust that. Please think about this if you're thinking about scheduling surgery outside the country. And even after all that time, I saw the doctor who had cleared my labs to get plastic surgery. And it'd been about a year since she had cleared me because I only see her really for like the very important things. And I just mentioned to her because she said that she liked my results when she was doing my physical, and we were just chatting. And I said, I encountered some really serious complications where I had like necrosis essentially after my tummy tuck. I was like, did I do the right thing where like you wait for your plastic surgeon to take care of you, or should I have gone to the emergency room? Like, what do you think? And she said that he did exactly what he was supposed to do. I know a lot of people on those surgery pages will tell you that a plastic surgeon is not a wound care specialist or a doctor. And I do think that that's to some extent that can be true. But like I said, this is where it paid to pay up for a doctor who wasn't just certified in plastic surgery, which obviously plastic surgeons work with burn victims, all of these things, but general surgery as well. He's been there. He's done some really crazy surgeries. He's had crazy experience, and that all tied into the professionalism and his skill set when working with a very serious case in my point of view of necrosis. I mean, in terms of what I've seen in necrosis out there, it was more mild, honestly, but it might as well have been major. I mean, it doesn't matter how big a hole in your body is. It just might as well be your whole entire stomach. You just feel like your whole entire life is falling apart. So I really just wanted to make that a point for you today. If you're thinking about doing a tummy tuck, if you're thinking about doing lots of surgery at the same time, whether you do just a tummy tuck or you do combination surgery, necrosis is something that happens. And it doesn't make someone a bad person. It doesn't mean that they did something to deserve it. It's just one of those things that really do happen. But it doesn't mean it has to be the end of the line. It doesn't mean that your results are going to be ruined. Stay the path, trust your plastic surgeon, trust your gut at the end of the day. Like, I'm never going to say that you shouldn't trust your gut, but try not to give into the fear and the sensationalism that people want to put at your door the minute that you share that you're going through this. They're going to want to scare you. And I'm just always here to reiterate the fact that you need to trust in your research and trust in your doctor and stay the course. This is really where it matters, is the post-op care and your plastic surgeon certifications. Muy importante. So if you have any additional questions, if I didn't answer any of those today, please let me know. There was so much to cover. It was such a long recovery. And looking back, sometimes you glaze over some details, but I wanted to basically just share that today, that sometimes things come out of left field in plastic surgery and in life, right? But no matter if you're going through it or it's something that you're about to go through, just know that God's grace is there for you. And it's a really good time to reach for the word. I came out stronger, and it didn't stop me from wanting to go on and do round 3, which I will share about more in the future. And I hope to see you there next week. I'm going to share a whole new episode and a completely different topic. Again, if you have any questions for me that I didn't address on this one, or about any topic that I've talked about on the podcast or haven't talked about yet, you can drop by Instagram at the Next Level Glam Podcast and leave me a DM. Or you can leave me a comment here on YouTube, whatever is easiest for you. I hope to see you next week for that new episode. And until then, guys, be sure to rest and grow in His grace.